The United States of America and its citizens are facing a national crisis, the opioid epidemic. The epidemic has taken the lives of thousands of Americans by means of overdosing.
The opioid epidemic didn't happen overnight. It has been affecting the U.S. for many years and those who misuse opioids.
The misuse of opioids could lead to the deep addiction to the medications, which would lead to various negative side effects occurring, which would also eventually lead to the ending result of death. While the opioid epidemic is the crisis that it is, medical marijuana is steadily becoming a plausible replacement to opioids as medication. Medical marijuana is becoming a replacement to opioids because the usage of opioids has more negative impacts on those who misuse it and to those around them.
The use of opioids leads to addiction more often than the use of medical marijuana. The rates for medical marijuana are actually more subtler than you might think. According to Amber Craig and colleagues, opioid addiction after initial use is 3.3% to 14% versus medical marijuana having a complexity to its addiction.
The National Institute on Drug Abuse states that 30% of those who use marijuana may have some degree of marijuana use disorder. Knowing this, the thought of replacing a drug we have used for decades with a drug that has higher addiction rates is alarming, but it's better than it may seem.
The National Institute of Drug Abuse conducted research and found that marijuana addiction has a greater presence in teens, sitting at 17%, rather than in adults, and it only has a 9% addiction rate.
This is an important statistic to take note of because for adolescents, opioids may be better, but while for adults with more developed brains, it may be advised to use marijuana instead.
An article that Inspired Malibu published states that marijuana is physically and mentally addictive, and is concerning for long-term users. Marijuana is proven to be addictive and has higher rates of addiction if started at a younger age.
This shows the concerns it may spark in parents and underage users before a treatment is started. With this, opioids can be argued in being a better solution if based off of statistical addiction rates.
Opioid prevention has become a major health priority.
Amber Craig et al. Stated that illicit drug users are more likely to experience social isolation, meaning incarceration and criminalization, homelessness, disability, and mental health illnesses. We as a society need to take steps to find better solutions to prevent opioid addiction. In short, opioids may be a solution for treatment of chronic pain in teens, but medical marijuana may be seen as a solution for adults.
Addiction isn't the only negative impact that's affecting those who misuse opioids. The side effects that arise after misusing opioids are just as impactful. As Vega stated, these side effects include pain, weakness, loss of memory, and loss of appetite. These side effects impact the quality of the user's lives, makes it harder for them to enjoy life, while also experiencing pain as well.
Opioids stimulate reactors. This releases dopamine, which sends signals to the brain, triggering a reward. As stated by Hemphill, this is the most threatening effect with abuse. The body will weaken its reactors, and they will need more and more to get the same effect. Combined with easy access, it makes it such a lethal drug.
Yet another alternative to opioids is medical marijuana. Medical marijuana is another alternative to opioid because its effects in acting as a pain reliever. The National Institute of Health researched that opioids are being used for neuropathic pain, including nerve injury, chemotherapy-induced, diabetic neuropathy, and etc.
These studies have been tested and have been proven after tests conducted on mice infected with the tumor. As Eagle Eye research, the results show that medical marijuana is effective in resisting the amount of pain received. Furthermore, it can be argued that medical marijuana could be an alternative to opioids. However, just like opioids, medical marijuana has side effects. Eagle Eye researched how medical marijuana is connected to symptoms such as loss of memory, cognitive impairment, reduced ability to focus, and incarnation.
Medical marijuana is known as a gateway drug, which is a habit-forming drug as defined by Bradford. Medical marijuana is likely to be used in adolescents. Studies show that there are significant declines in neuropsychological functioning and IQ among daily users who begin using in adolescence.
Not only does the misuse of opioid medications possibly lead to very negative side effects, it also leads to many overdoses that plague the United States and its citizens.
The death toll that opioid overdoses accounts for is substantially higher compared to the nearly non-existent amount of medical marijuana-related deaths.
According to the National Institute on Drug Abuse, in the year 2015 alone, more than 33,000 U.S. citizens passed away from an opioid overdose. These approximated stats on the number of Americans that overdose on opioids show just how much of a national crisis the opioid epidemic really is.
Although the epidemic is a crisis that takes and will continue to take American lives, if not stopped, the condition will only worsen.
As stated by Desert Hope, opioid medication has provided millions of patients the positive effects of taking the drug and are still being used in a variety of different cases where pain-killing solutions are needed. Having cases from millions of patients showing positive outcomes carries a heavy weight in the debate between medical marijuana and opioids.
However, these sided with medical marijuana would argue that it is just as effective of a treatment as opioids, if not better.
In a study that was documented in Marijuana for Pain by Jane Leonard, approximately 3,000 medical marijuana and opioid users were asked which medication they would prefer using. The results showed that 97% of the participants believed they could decrease the amount of opioid medication they use.
Even though the study was done with a mere 3,000 participants, it shows hope in decreasing the death toll if opioids are replaced with medical marijuana.
Completely eliminating the opioid crisis is a task that is not going to be the easiest to accomplish, but will not be impossible. If the nation eliminates the misuse of opioids, it will also eliminate addiction to the medication, eliminate the side effects that misusing entails, and thus ultimately eliminating the unfortunate death toll. As a group, we have suggested 3 solutions to combat the opioid crisis.
First, a campaign to inform American citizens about opioids will reduce the misuse of opioids. We'll educate the public about opioids' effects and the dangers of misusing opioids. This will inform future users the dangers that opioids could be. We as a group believe that public education is important because it will reduce patients seeking opiates as medication and instead look at other alternatives such as medical marijuana.
Secondly, as of now, opioids are being prescribed like it's nothing. It's shocking that such a dangerous drug can be given without a second look. It's a big problem in modern America today, and a solution we have found was reducing prescriptions given, and that will equate to less opioids being distributed across America, and it will equal less misuse.
Lastly, programs being implemented by states and organizations that replace opioids with medical marijuana could also reduce the amount of opioid overdoses that occur. New York State has begun this process already. According to the New York Department of Health, opioid usage is a qualifying condition for medical marijuana to be used as a replacement. A result of this change showed reduced amounts of opioid overdoses.
Ultimately, the future of the United States will be brighter if more action is taken now.
Nationwide public education, limitations on prescriptions, and statewide programs will ensure the future of the United States to be clean of the epidemic that is the opioid crisis. Yes.
Isaac. Describe how the content of the team presentation was changed as a result of group discussion.
I feel like the content of the group project was changed a lot due to discussion, considering that in the beginning we actually had a different thesis statement, and due to rediscussion I actually ended up changing my claim specifically instead of having the original one, and I feel like without that it wouldn't have made our presentation as strong as it was now because it was more like diluted instead of being more focused in, but through group conversation we kind of were able to focus in on a main point.
Good. Tyler, what is a way in which your team's resolution makes you think differently about your own individual research?
Can you repeat that?
Mm-hmm. What is a way in which your team's resolution makes you think differently about your own individual research?
It makes me think that there's many ways to solve the opiate epidemic.
Josh, what was the strongest counter-argument to the solution or conclusion your team identified and why?
A counter-argument that we all basically had was that even though opioids, they've been used for decades and are still like providing positive outcomes for patients, that medical marijuana is still like a solid replacement that could not only be as effective as opioids, but could help reduce the amount of opioid overdoses in the U.S.